My name is Joshua Tuck, and I'm an orthopedic sports surgeon here at LECOM Health.
And I'm John Stehlin, weather director at Erie News Now for First Warning Weather. What I liked about it was that I got into the emergency room and I was seen really quickly. And I didn't have to go through halls and halls of people, and there weren't thousands of people going around. I just felt it was just so much more convenient for me. So when I had some issues, especially when I had that fall that caused the shoulder problems, I got in, got my x-rays real quick, and I was happy. And basically they said, we want you to follow up at a certain time with this person. So that's how I met Dr. Tuck the first time. And once I talked to him, he and I have a pretty good understanding. He likes to listen. We're both scientists, so I'll ask a lot of questions to try to come to the right answer. And he was very accommodating, and he will answer everything you want to answer, no matter how bizarre it is.
John's a great patient, a good friend, and I've known John for years, and I've operated on several joints for him now, not just shoulders, but I believe knees as well. So, yeah, it was great to have the opportunity to get out there on the news and share a little bit about what we do. John's case was unique in that this was his second shoulder surgery, the first on this side. He had had a previous rotator cuff repair on the contralateral shoulder. And so we do see people that tear both shoulder rotator cuffs. It's less common, but we do see it. He had a very large tear. Out of the 4 tendons, I believe 3 of his were involved. And so he had a fair amount of surgical repair work to be done.
Well, when you're in pain, it impacts your life, you know. I mean, obviously, I do move my hand here, but at the same time, when I'm, at the weather wall, and sometimes I have to type as well. But also, I mean, it affects your work because it was affecting my sleep. So that was really tough. So, days you're really groggy in that, and then you would have pain going on throughout the day. So there's a lot of aspects. It's not necessarily I have a lifting job, I have to carry things, but this is what this is, pointing to maps, but it's the typing, and it's just really the lack of sleep that really will affect the bottom line for the rest of your day.
So the rotator cuff is made up of 4 muscles around the shoulder, and it's a force coupling mechanism that provides stability to the shoulder and also muscular function through the joint. It's made up of the supraspinatus and the infraspinatus over the top of the shoulder, the subscapularis in the front of the shoulder, and the teres minor in the back of the shoulder. A rotator cuff tear is when any of those muscles either partially or completely tear, either at their insertion point onto the bone of the humeral head or in their mid-substance.
You have to get into the right mental state. And that means be prepared, have all the supplies you need, have the help that you want, that you need as well, and don't be shy if someone offers to help you. Always say yes. Don't be a hero. It's like, oh, you want to do that for me? Go right ahead. Yeah. And yeah, I do trust him implicitly, and with my platform, for me to even say it publicly means that I do have a lot of trust in him, of course. But of course, everyone has their own needs and wants as a doctor, so you have to go talk to him and make sure that that's what you want. But easygoing, answers every question, make sure that you're feeling good. And those are the things that you want. And the biggest thing is the education, meaning that if I ask a question, he will answer it. That's what's important. You just don't want a doctor who's just saying, oh, don't worry, you'll be fine in that. But no question was too stupid. And remember, and if you know me, I test people. So I made sure that he knew what he was talking about. And
patients who are interested in an evaluation and possible surgical intervention should reach out to me at LECOM Health. 868-7840 is our office number for the orthopedic surgery department, orthopedic surgery and sports medicine. And we try to get people in as soon as we can. To get the evaluation. Typically, you can expect to undergo a set of x-rays first to rule out any fractures or any bony issues that could also be a source of your pain, and followed by an MRI if it's indicated. Like I said, there's a number of factors involved in that. But a good, thorough history and physical exam determines who is best suited for an earlier MRI. Surgery, in the event that you are indicated for surgery, can either be done at the new ambulatory surgery center on Peach Street, or it can be done at the hospital, the LECOM Medical Center. And again, that depends on a number of factors, patient comorbidities, sometimes patient preference, scheduling, that sort of thing. So we work with the patient to determine the best fit in the event that surgery is indicated.